Three respected plastic surgeons had different opinions. Any suggestions? Three respected plastic surgeons, each has a different opinion. Number 1, face lift, neck lift, upper eye lift both eyes, fat grafts transfers, and dermabrasion around mouth. Number 2, face lift, neck lift, upper eye lift on right eye only, said not enough extra skin on left eye, lower eye lift on both eyes, and full face laser. Number 3, face lift, neck lift, with very small incision under chin to liposuction, fat grafts, and templeplasty for right eyelid. We did not discuss laser or dermabrasion. What to do?
Thank you for your question. You've submitted several very good photos of your face from different angles, and you write in your question the details of 3 different doctors who made recommendations to deal with your upper lids, your lower lids, your sagging skin in the face and neck, as well as some wrinkles around the mouth. And so, to your surprise, of course, you have 3 different opinions. Well, this is going to be the reality with every doctor you meet, because we all, as surgeons, have a certain style and how we do things and a certain way we look at things. That's why cosmetic surgery is not a generic procedure. One of the most common mistakes people make is thinking that an upper eyelid lift or a lower eyelid lift is the same no matter who you go to. As a specialist in eyelid surgery and facial rejuvenation surgery, I see patients from around the world who come to us in our offices in Manhattan for many different types of complications or undesirable results. It may not have been, quote, a complication, but the aesthetic of what they got at the end did not look right. For some people, their eyelids are pulled down. For other people, they feel like their face was not lifted well enough. Sometimes they have undesirable scarring. So there's a lot of different issues. If you're trying to look for the one definitive answer, it's not likely you'll find that. I think that when you met with these doctors, one of the things you could have also done was review their results and look at people that may share some resemblance to you in terms of ethnicity and age and similar enough anatomy. Experienced surgeons have lots and lots of before and after examples that are theirs. I've been in practice for over 20 years, and so prior to the digital world, we used to have a lot of our before and afters in big binders, and we still have them in our office. So if a patient wants to see some before and afters, they have some heavy binders to look through, and it helps them understand a style. As far as defining your issues, I would agree that your upper eyelids have hooding. Your lower eyelids have puffiness. There are wrinkles around the mouth, and there is also some volume loss in the cheek area and sagging of the face and neck. Routinely in my practice, and this is in the absence of doing a physical examination, we would address the upper lids with an upper eyelid blepharoplasty, the lower eyelids with a lower eyelid blepharoplasty, typically a transconjunctival approach. A lot of times people with puffiness who are like over 40 years old will often have laxity of the tendon, the lateral canthal tendon, and that needs to be reinforced. As far as the skin quality around the eyes are concerned, we routinely do use platelet-rich plasma, which is something different, and that can also add to your confusion. This is a material that we derive from your own blood that stimulates the skin quality through collagen and blood vessel generation. In addition, we would do something called a fractional CO2 laser to address wrinkles around the eyes. We'd use the same fractional CO2 laser to address the wrinkles around the mouth. As far as fat grafting is concerned, certainly that's a consideration. And a lot of our patients also, who really want volume in the mid-face, will place a submalar implant or a cheek implant. May seem invasive, but when you're dealing with a lot of sagging, there's only so much volume you can put in the skin before it sags as well. And again, it's a matter of your personal aesthetic. How much volume are you looking for? I would suspect that the colleagues who are interested in doing fat grafting want to put it in the mid-face to allow some volume so that when the face is lifted, the mid-face looks like there's a more youthful appearance. You know, the cheek areas are often overlooked, and we always refer to it as the apples of the cheeks to give that rested and nice youthful appearance back. As far as the skin and the face is concerned, the sagging, face and neck lifting, which it can be done in a variety of ways, and ultimately what your goal is to restore jawline, elevation of the cheek, nice angularity of the neck, and just an overall younger appearance. So as you can see, even with my looking at your photos alone without doing a physical examination, I have some agreement with the colleagues who made their recommendations, and I have my own personal style on how I address a lot of these issues. Every doctor will do things that they feel work for them. And again, to re-emphasize, it's not generic. You know, in one colleague's hands, dermabrasion may work as well as laser in another colleague's hands, and each will have their reasons for the benefit of that treatment. It's very important to always understand that with respect and sharing of and a difference, I should say, in professional opinion, that we always very often will say, in my hands, this is what I like to do, and these are the results that support why I do what I do. And so it comes down for you to be comfortable with whoever it is you're going to have do your procedure. If you remain confused, then get additional opinions. It's very important that you not be conflicted when you're walking into surgery. It is very unsettling for everyone that if you don't have trust and complete faith in your doctor before you have surgery, then it's going to be a rocky road after the surgery. So it's good that you're submitting this question to us to review, but I think it'll be in your best interest to really make some distinctions, and maybe even whenever patients come to me and say that I'm one of the doctors they're meeting, I'll say to them, well, after you meet with the other doctors, if there is something that sounds different from what I'm recommending, you're welcome to ask me about it, and I will certainly share with you whether or not I agree and why I agree or disagree. But it's very important that we always use come from a position of respect. A lot of doctors have a tendency to be very disrespectful to their colleagues, and it's very unprofessional. Everyone's smart, everyone has experience, and whichever specialty they practice, it's very important to understand that you don't know what everybody else is doing and why they're doing, because you're busy doing your own thing. So just so to give you some general perspective, you will probably have some more opinions that may be slightly different, and you're going to have to at some point make a decision, and when you're comfortable and have the most amount of faith to move forward with your surgery. So I hope that was helpful. I wish you the best of luck. Thank you for your question.